Hi, everyone, and welcome to our first stakeholders update of fiscal year 2023, which began July 1st. I'm so excited to see so many of you joining. Want to start off, of course, with our mission, which is to advance medical research, promote disease awareness, and provide support and education to people with scleroderma, their families, and their support networks. So this is the heart of everything we do, and I'm going to share a little bit with you today about our work in each of these mission pillar areas. So we've talked a lot over the last year about our foundational work that we've done to really streamline our governance and our organization and our structure. So just want to remind everyone of what that looks like, led by our very capable National Board of Directors. We do have a few new organizations within the foundation, so they're highlighted here in bold teal. Our chapter leadership council, which is made up of the chairs of all of our chapter advisory committees across the country. And then we also created a patient advisory board, which is brand new and just populated over the summer to mirror our medical and scientific advisory board to advise the board of directors on matters related to patient quality of life, patient priorities overarching across all of our mission pillars. So research priorities, support, education. Really excited about that group getting going, and they're just having their first meeting actually in Q2 of this fiscal year. So you'll hear more about that as we move forward, but wanted to remind you of those couple of new groups under our governance structure, and then share with you our board of directors for the fiscal year, the service year that just began July 1st. We did appoint a new chair, Kevin Boyanowski, and that was announced in our summer issue of The Voice. Hopefully you had a chance to read and learn a little bit about Kevin. There's also a bio up on our website at scleroderma.org. The rest of our executive committee remains unchanged, and we have added two new board members, Zeba Hyder from the Tri-State chapter in New York, and then Mike Purcell, who is with the Rocky Mountain chapter in Denver, Colorado. So excited to have those folks on the board and joining us this year, and just know that they'll add tremendous value to our wonderful group that we have here. And this is just a reminder of your wonderful staff team who's here to serve you and support our programs and services every day. We had a staff retreat in August, and so it was the first time for a lot of us to meet each other in person, but a really great time to be together. I'll share a little bit more about that further in my presentation. But today I really wanted to focus on our goals for fiscal year 2023, which again runs from July 1st, 2022 through June 30th, 2023. And our goals are really focused in three areas. Certainly mission is the first, but culture is a really important part of our work for this year. And then of course, philanthropy. So I want to dig into these a little bit. And before I do, I would love to ask for your help to help us track our progress in these areas. So we're going to be doing a few pulse surveys throughout the year. So if you don't mind going to bit.ly/NSF-Pulse and taking a quick 10-question survey, it'll just take you a few minutes. It's going to help us track our progress toward engaging our community, make sure that our programs and services are meeting your needs. We do plan to do a more comprehensive needs assessment around our specific programs and services, but this will really kind of just give us a good jumping off point to understand our community and who's engaging with the foundation. So that's bit.ly/NSF-Pulse. And I will send it out with the recording as well. If you are a QR code person, you can actually just point your phone, put your camera on and point your phone at the screen, and it'll pull the survey up for you. So I'll give everyone just a second to do that. This will also go out in our newsletter on Friday. So if you don't capture it here, don't worry. I'll also ask a member of my team to maybe drop that into the chat for everyone. It's bit.ly/NSF-Pulse. So thank you. It'll help us get kind of a pulse check on our community, see how we're doing, how we're starting out the fiscal year here as we're getting just toward the end of Q1. Want to give you a preview of some of the metrics we'll be tracking as we track our progress. We're looking at the number of constituents that we're engaging in the US. So right now we're sitting at 225,000. Looking at, of course, how much we have in our coffers, how much we have in reserves. And so right now we have 150% of our operating budget in reserves. So I'll talk a little bit more about that later. Of course, our dollars raised is a huge goal. And so far in fiscal year 23, we've raised $850,000. So that's between July 1st and today. And then we're also looking at a lot of different engagement metrics, but one of them is certainly our website hits. And so we're averaging just under 40,000 hits per month. Thank you, Lauren. She's dropped the pulse survey link into the chat for everyone. So I'm going to go into our goals in the areas that I mentioned of mission, culture, and philanthropy, and share with you some updates in these areas as well. So our goal in the area of mission is really making sure that everyone who needs us can get to us, no matter where they are across the country. And so a few of the ways we're doing that is, of course, looking at access in terms of our programs, looking at the programs that we offer and making sure they're meeting the needs and priorities of our community with respect to those 3 pillars of support, education, and research. And then we're also looking at where our chapters are located and making sure that you can see we have some gaps here. And so we're assessing that and doing some capacity planning. We have 16 chapters right now, and we have 6 executive directors who are staff those chapters. And so we can do the math and see that we have some chapters who don't have any staff. And so we're working now to make sure that we can get staff where they're needed, but also that we can get chapter coverage where it's needed and get into some of these gaps and make sure that people can access our programs and services. When we look at the coverage of where those chapters provide coverage to, the shaded states are considered part of a territory of an existing chapter. And so it's just another way to look at it. While I'll pick on tri-state, while the chapter sits in the state of New York, it actually covers 3 states, which you can guess from its name. And so those are represented here: New York, New Jersey, and Connecticut. New England is the same. They're based in Massachusetts, but cover several states in the New England area. So by looking at those catchment areas and doing some capacity planning, we're starting to think about how we can best serve the scleroderma community all across the country. One of the other ways we're looking at this is looking at the impact of scleroderma in the US based on population. And so you can see the darker shaded states are those with heavier concentration of residents. And so you could reasonably conclude that it would have a higher population of people affected by this disease. We don't have great data on this. And so this is kind of what we're working with for now to kind of look at where we need to concentrate our efforts. And right now we are working with the Texas Bluebonnet chapter to really expand their reach and network within the state of Texas. So we're going to use that to build our case and then go to our different regions where we may not have existing chapters and start to build those out. I'm really excited about that work. So jumping into some of the actual work and programs and services within our mission pillar, I want to share some of the new things that are going on with respect to support. We did have a new class of spin sled trainees start for some of our new support group leaders. It started in August, and we have 11 participants who are now in training. So really exciting program, and kudos to those folks going through it. We have 2 new designated scleroderma centers. So when you go to our website and look for a designated research and treatment center near you, if you are in Tennessee or in Northwest Florida, you now have some options where before you may not have. Lucky to add Vanderbilt and the Mayo Clinic in Jacksonville. We continue to push this program and really attract great centers from across the country to make sure that we have coverage and that we're able to promote the work of these centers to people living with in those areas. Also want to highlight our Hope Line, which continues to get a lot of calls and emails. We're starting to track some trends around that so that we can better anticipate the needs of the community and even develop programming in response to some of the themes that we're hearing from you all when you're calling in, and make sure that we're being as helpful as possible. In terms of support group highlights, we are delighted to share that there is a brand new support group. It will be a virtual group starting in early October, and this will be an email went out this week actually to those who have already expressed interest, but we'll include this on our website as well. for those who are newly diagnosed or the family member or friend of someone who's newly diagnosed, a special support group just for you to get the resources that you need. We have a new support group starting up for that. So really excited to kick that off. The next thing we're looking at is actually a support group for people with scleroderma who identify as LGBTQ+. And so if you're interested in helping to organize or lead that group, please let us know. You can email us at info@scleroderma.org, and you can help us get that group going. So we've had some interest in that area, but looking for some leaders there. So moving on to education, we do have a CME program, which is continuing medical education for healthcare providers coming up at Vanderbilt, one of our new centers this fall. And then we have a lot of outreach going on with our partners in the public and professional association and nonprofit space. And so you can see 4 different meetings that we have a presence at this fall, including Pulmonary Fibrosis Foundation, NORD, PADRA, and ACR. So we're excited to be able to partner with them and have a presence there and engage with their communities as well. I'm excited to announce that Kids Get Scleroderma 2 is coming up very soon, just next month on October 22nd, 2022. It is a Saturday. This will be a virtual program and registration is open. So you can head to scleroderma.org/kids for more info on that. This is a great time for families and kids who are affected by scleroderma to get together, learn more about the disease and how to thrive once they've been diagnosed. Thank you to everyone who participated in our National Scleroderma Conference in July. We had over 500 people online, which is really exciting to see all of you and be with all of you. This is my first update since then, so delighted to share with you that we have had more than 500 registrants for that meeting. We had 36 sessions, which I know many of you were online trying to juggle that and pick which ones you wanted to go to as well. 8 wonderful exhibitors, and then 17 poster presenters in our research hall. This was such a cool platform and a cool conference. I hope everyone really enjoyed it. It was nice to be able to be with you all, and loved the interactive format of that. Be sure that you save the date for 2023. We'll be back together in person in Orlando, Florida, July 14th through the 16th. So we'll be in sunny Florida. I'm looking forward to being with you all there. Moving on to research. We just wrapped up our research application deadline, September 15th, and we did receive 28 applications in response to our call. 10 of those were for new investigator awards and 18 for established investigator awards. That funding will be approved once those go through peer review. And so that typically happens in December. So we'll announce those in the new year, but really excited to have a good response to our call for applications. We also were excited to welcome our early stage career investigators to Boston this summer for our first face-to-face early career investigator workshop since 2019. So that was really fun and got to be together with the investigators. They'll meet again in December for a virtual workshop. Also in December is our next global research webinar series. You can register for that on our website at scleroderma.org. But that's been a really great series where we get to hear cutting edge research from the best and brightest in scleroderma. And I want to congratulate all of our wonderful advocates all across the country who have worked so hard this year to ensure that scleroderma is included as an eligible condition for federal research funding under the Department of Defense. And so because of your hard work, we actually are included now as an eligible condition for study. So congratulations and thank you to everyone who participated in outreach and calling your senators and representatives and writing letters. It really did pay off. And so we don't want you to stop now. We want you to please stay in touch. Please take the time to thank your elected representatives for backing any policy that supports the scleroderma community. And we really do want to make sure that scleroderma is included in that final appropriations bill. So we haven't won just yet. It's in the draft. Keep at that for us, please. And that's really important because that allows for continuity of really important research into scleroderma at another federal level. So thank you again to everyone who's helped with that. So I think I shared already about support and education and research. I'm going to move into culture, another one of our goal areas. So one of our goals for this year is really to be intentional in the culture that we design and deliver as an organization. And the aim of that is really to make sure that we're increasing engagement, not just of our staff team, but of our volunteers and our members and everyone who engages with the foundation. We have had just a season of tremendous change at the foundation over the last year. And so we really want to foster a sense of stability and forward focus following that. But we also want to support a culture of philanthropy. So we did spend some time as a staff team in August thinking about what we want our culture to be and being really intentional with our words. And so I want to share this commitment that we've made to one another with all of you, because we're bringing this out to our community to share that we share a commitment to our mission, and that inspires us to always do our best. We take our care as a team to build connection and foster trust with each other. We lead with integrity, and we steward a community in which everyone can share openly and engage authentically. So definitely want you to hold us accountable to this. This is something that we're really passionate about, that we believe is really important to the work that we do, and something that we want to bring out, as I said, to the community and invite you into this culture so that you can add to it as well. We also spent some time doing some values work, which we'll continue to do this weekend with our leadership at the national and chapter level, and identified our core values as being, among many others, care, connection, diversity, integrity, meaningful work, and trust. And I mentioned how this feeds into building this culture of philanthropy, and this is not new for our scleroderma community, but it is really important to the work we do because we have really lofty goals in terms of what we want to be able to support. And so we need to be able to increase our funding to support our investment across those mission pillars. And so really creating that sense among our community of how wonderful it is to give and the joy that you get from that and being a part of something bigger than yourself. We're really excited to, again, invite everyone into that and share with you what we're doing there. So just a few of the data points to give you an idea of where we are in terms of our philanthropy. This fiscal year, just in the last 3 months, we've raised $850,000. We have a long way to go, but excited to invite you all in again to help us meet our goal there. Want you to save the date for a big day of giving coming up in just a couple months on November 29th. It's Giving Tuesday, and so we really will be doing a lot of outreach and asking everyone to dig deep and within your communities, within your families and networks to really give on behalf of the foundation. We also have, of course, our Stepping Out to Cure Scleroderma walks, which are a big part of our culture and engagement here. We've had 31 walks this year with over 4,000 participants. So thank you to all of our fundraisers, all of our walkers, everyone who helps to put on those successful events. There's such a good time and such a great way to raise awareness and raise support for the foundation. I am also delighted to share that next year is our 25th anniversary. So you'll be hearing much more about that. But wanted to let you know that 2023 will be a year of celebration as we look at the impact that we've all had together since we were founded in 1998. Hopefully everyone has received their fall issue of The Voice. This issue features a few really cool things. One is our men's support group. The other 20% celebrated 1 year this year. So that was a really cool milestone for them. And so they have a great feature in the magazine. We have some highlights from our June Awareness Month, from our conference in July, a great article on palliative care, and then a great feature on the International Scleroderma Conference that's put on by some of our own volunteers as well. If you are not getting The Voice, please let us know at info@scleroderma.org, and you can also sign up on our website. So nearing the end of my update here, always want to be transparent with you all about our financial health and where we are. It's really important as stewards of the foundation's resource. So here are a few benchmarks just to look at, again, at this kind of snapshot in time. As of the July financials ending July 31st, 2022, we were $150,000 ahead in terms of our budgeted net income. Our investment income was actually $450,000. Again, a snapshot in time. This might be a rough year for investments, but As of July, we did have investment income at 450. And then I mentioned earlier operating expenses that we had available in reserves. And so this is an important benchmark we track. Right now we have 18.4 months available, so a year and a half. So essentially this means if we didn't raise another dollar, we could keep our doors open for 1.5 years with our current budget fully loaded the way that it is now. So again, something that we always like to keep our eye on. The industry standard is about 6 months. We really want to have at least 12 months, but feel much more comfortable being somewhere between 18 and 24. So that's a great thing to look at. And then we are in the throes of our annual audit. And so our audited financials will be available to you all by December 1st after the board approves those in mid-November. So I wanted to give you an update on that. So with that, I am going to stop share. Thank you all for your time and attention, and take any questions anyone may